I'm Dr. Josh. This is a video I'm making for a patient. They know who they are. I'll be sending you this video. And they're having some back pain and they're really quad dominant and they don't have great thoracic extension. They have a hard time doing like overhead squat, overhead lunge. They have a really hard time getting their arms out and back behind them. When we tested some things, a bit tight through the lats, a bit tight through the upper back. Hips were actually pretty good, but their hinge could use a little bit of work. So these are the drills we're going to use to try and open up the upper back while really trying to nail down that hinge pattern, make them a bit more efficient, move a little bit better, hopefully calm down that sensitive low back. So for the upper back, we'll do the wall slides and we're going to do some rotation extension drills out of a cat-cow position. The wall slides, we're going to do 3 sets of 10. Play with your foot position. If you're close, it's easy. If you're far, it's a bit harder. Keep the tempo nice and controlled and drive those forearms into the wall the whole time. So set of 10 there. From that, we can do our child's pose rotation drill. So we sit back into that child's pose, do our chicken wing, and then just simply get some rotation going. Don't forget to breathe. Again, keep the tempo controlled. 8 to 10 reps per side, just like that. That'll cover, at the beginning stages, the mobility we need for our upper back. It'll get us started there. And then for the hinge patterning, we have 2 drills we're going to do. One-legged Romanian deadlift. In the clinic, we did this one together where we held each other's arms and fought each other for that deadlift position. Since you don't have a chiro at home, we're gonna play around with a band here. We'll anchor the band to something nice and stable. I'll use my squat rack for now, but at home, a counter or like a stable staircase, like the pillars in it, like a banister, that could work too. And then we are going to take that band, have it so there's a bit of tension in there, and then work our way into that deadlift. So push that back leg as if you're trying to push that leg through the wall behind you. Okay, you can hold one arm and do both sides. And when we do this, a little bit of knee bend is fine, but we're really trying to create a hinge through the hip. Long term, we'll progress this to more of like an actual hinged variation with some real load, but this is a good starting point. The last exercise we'll do for this is laying flat on our back. We'll do some hip hinges as well. I showed you 2 variations in the clinic, and we'll just go through those real quick. The first one is both legs together. We're just laying on our back here. Drive the hips up, hold it for a moment. Come back down. This one was pretty easy for this patient, so we made it harder. Drive the hips up, straighten one leg, hold it for a beat, and come back down. For this patient, I actually told them at home, maybe take your cell phone or a water bottle, put it on your lap, because it's really easy when we're tired to do this drill. We tilt, and then we lose a lot of the control, the glute, the core, stabilization, all good stuff that we're trying to maintain. So if you have a cell phone or a water bottle there, it's gonna fall right off. You're gonna know you missed it. Reset, go back to the easier version, or just reset on the harder version, and just make sure you keep those hips squared. So for the banded deadlift and for the one-legged glute bridge, keep it simple, 3 sets of 10, 3 sets of 10 on the wall sides and 3 sets of 10 on the rotation. You can do it as a big circuit, just boom, 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 one after another, or you can superset it with the other things you're doing already in your workouts. It could be active rest. None of these should be so challenging that you're totally gassed after. So you can just plug it in any way you see fit, whatever's gonna work best for you, and try and hit it at least a few times a week. They're all gentle enough, you could do them daily, but even if you got this every other day, you'd still see some great progress. Let me know if you have questions.